Hi, my name is Rachel Taylor and I am here to present a presentation on human immunity. So let's start by talking about infections. What is an infection? An infection is caused when a pathogen enters the body. It can result in a fever or other health problems, depending on where it occurs in the body. Then the human immune system defends the body from infection or disease caused by pathogens. If we do become infected, the immune system can destroy pathogens and in most cases protect a person from illness. Now we will look at each one of the infections. We have bacteria are known as food poisoning, viruses such as influenza and COVID-19, a fungi such as thrush and athlete's foot, and also a parasite. Pathogens can be transmitted from one person to another. Pregnant women can spread pathogens to an unborn baby via the placenta or via breast milk. Pathogens can also be spread by eating contaminated food and drinking contaminated water, and also through animals. So, how does the body defend itself? The body has specific and non-specific lines of defense. Now, let's look at non-specific defenses, in which there are two responses. The first line of defense are chemical and physical barriers that do not distinguish between specific pathogens. They act in the same way, whatever the type of pathogen it is. Now we will talk about the different barriers which protect the human from infections. Here's one of our first physical barriers we have, and that's our skin. Pathogens cannot cross the skin. Unless the skin has a cut, then the pathogens can pass through that way. Skin creates a watertight mechanical barrier that serves as the body's primary defense. We have glands in our skin that secrete oil which kills microbes. We also have very fine small hairs that are called cilia, and these fine hairs are usually found up the nose and in your windpipe. These hairs help to track pathogens that have tried to enter the body. Then they get coughed out or even sneezed out, blown out the nose, and a genital and urine tract for harmless bacteria in the genital tract. Together with mucus prevents pathogens from entering the body, and the body has tears and sweat that contain enzymes and salt also found in the sweat, which can destroy pathogens that way. For another first line of defense is a mucus. Mucus is found in the nose and throat, which is a thick liquid-like substance that traps pathogens inside the stomach. And the stomach contains hyaluronic acid and pH levels of 2 microbes. And these are unable to survive in such acid conditions, and enzymes produced in the stomach can kill the pathogens, and a urine washes the microbes out the urine tract. Now we're going to talk about the second non-specific defense mechanisms, which involves response within the body. If the pathogens can get past the first line of defense, for example through the cut in your skin, and an infection develops, the second line of defense becomes active. The second line of defense of non-specific defense mechanisms involves response within the body, and if the pathogen can enter it. The inflammatory response is the first body's response to an infection. This is where the blood supply to the area affected will increase so that the cells can destroy the pathogen and can reach out to the area quickly. There is also an increased temperature, and the area may become red and swollen as the pathogens are destroyed, pus is formed, and then they break down. So let's look at fever. For example, a fever will develop in the rest of the body. As some pathogens cannot live above a certain temperature, they are killed. These cells found in the body are generally known as white blood cells, and they are several types. We have neutrophils, and these cells can move by the process of chemotaxis through the blood vessels and are usually the first cells to arrive at the site of inflammation or infection. They force the invading organisms via phagocytosis, then use and force again the enzymes to destroy the pathogen. Cytokines release chemicals which are used to attract other immune cells to the area, and other small proteins called complement proteins which can destroy the pathogen. Cytokines can cause a cascade reaction. They stimulate the production and release more cytokines, and there are different types of cytokines which target the different immune cells within our body. So moving on to monocytes and macrophages. Now these are the cells that are found in our blood. Once the monocytes arrive at an infection site, they undergo changes and then they become macrophages. This will force pathogens via phagocytosis, and once ingested, enzymes inside destroy the pathogen or foreign particle. Monocytes arrive at the infection and they undergo the changes and then they become macrophage. Pathogens are engulfed via phagocytosis and enzymes destroy the pathogens. Some macrophages are found all over the body. So let's look at antigens and the pathogens. If the pathogen such as a bacteria or virus manages to invade the non-specific immune response, they will come against our third line of. There are some situations that the innate immune system can't handle. For example, there might be too many bacteria or the bacteria might multiply too quickly. That's when your adaptive immune response or third line of defense kicks in. The third level of your immune system consists of cells tailor-made to get rid of the specific microbes that have invaded your tissues. Special cells called dendritic cells are license or response point of communication between innate and adaptive immunity. They travel to the site of infection where they phagocytosis and break off small parts of pathogen. They then carry these parts to your lymph nodes where the adaptive immunity begins. The adaptive immune response involves two main types of specialized white cells called lymphocytes, B cells, found in the blood and produce antibodies. Immunoglobulins, also known as antibodies, are glycoprotein molecules produced by a plasma cell, and these are known as white blood cells. They act as a critical part of the immune response by specifically recognizing and binding antigens such as bacteria or viruses and aid in their destruction and work with T cells. The body makes millions of different T cells and each T cell can recognize a different type of pathogen. This means your body can combat almost every invader, even the one it's never seen before. Memory T cells remember pathogens seen before. They help your body launch a quicker, more effective defense the next time around. Cytotoxins T cells destroy any of your own cells that have been infected with the virus. T helper cells help other cells such as B cells, often by releasing proteins called cytokines, and these proteins bind to other cells in your body and tell them how to strengthen their immune response. T regulatory cells, they shut down an attack launched by the immune cells once the pathogen has been cleared. This stops the immune response from getting out of control. Usually T cells can eliminate bacterial infections just days after they've been activated. At this point, your body can stop fighting and you'll start to feel better. Acquired immunity is also called specific immunity because it tailors its attack to a specific antigen previously encountered before. Its hallmarks are its ability to learn, adapt, and remember. Acquired immunity takes time to develop after first exposure to new antigen. Let's now move on to self-recognition and tolerance in the immune system. Antigens are found throughout the whole body. Also in harmful pathogens are used by the immune system to signal whether it should attack or not, depending on whether the antigens are foreign or self. Foreign antigens are found in pathogens and will be remembered by B cells when they are recognized in the body, triggering antibody production when identified. All nucleated cells have a unique surface molecules that identify them as self. They are known as self-markers and named major histocompatibility complex molecules, or MHC class 1. The immune system has a self-tolerance, which means it will not attack cells with these MHC class 1 identification tags, although in rare cases a person may develop an autoimmunity disease, which occurs when the B or T cells become activated against self-antigens, but it isn't known why. Hyposensitivity is the occurrence of an abnormal immune response caused by repeated exposure to a particular antigen. Hypersensitivity disease can be grouped based on their underlying causes as seen on the slide, with some examples. So you have immediate type 1 hypersensitivity, antibody-mediated type 2 hypersensitivity, immune complex mediated type 3 hypersensitivity, and cell mediated type 4 hypersensitivity. So an autoimmune disease can occur all over the body and cause fatigue, muscle aches, a low fever, and even inflammation. This is a long-term condition that causes pain, swelling, and stiffness in the joints. Rheumatoid arthritis is one of the most common autoimmune diseases described by the NHS. The condition usually affects the hands, feet, and wrists. There are no known cure for root. Now moving on to organ transplant. This is where it's carried out to correct an organ malfunction with a healthier organ given by a donor, and it is often a lifesaver procedure. Unfortunately, the immune system does not always accept the donor organ. They view it as a foreign agent sometimes, and the process that follows is known as rejection of the transplant. As discussed earlier in the presentation, the immune system can recognize antigens on the surface of cells as foreign or self. In the case of a transplant, the immune system may not recognize the antigens present on the organ, and it may innate an attack. To improve the chances that the body will accept the new organ, physicians will try to closely match both the organ donor and the recipient using a procedure called tissue typing. A medication containing monoclonal antibodies is also used during after surgery to fight off a specific T cell known to cause rejection. If rejection does occur, it will be as one of the 3 types shown here on the slide. The most common rejection seen is acute, as all recipients will experience some amount of acute rejection. For example, hyperacute rejection would be if a recipient is given the wrong type of blood. Artificial immunity is gained when antigens are introduced to the body via a vaccine, which causes a reaction in the immune system. This reaction stimulates the production of antibodies and the memory cells in the way as the active response. If the body should become infected with a naturally occurring antigens after a vaccination, the body can attack and destroy them before symptoms of the disease develop, and this is called immunological memory. Natural passive immunity is when antibodies are passed from person to person, such as in the cases of a mother and an unborn child. Immunity passed on in this way can provide protection up to 6 months. Artificially induced passive immunity is acquired when a person receives antibodies made by someone else in form of a transfusion or injection. Protection from artificial induced passive immunity lasts for only a few weeks as the immune system is not stimulated in the process. Now we're going to talk about vaccinations. What is a vaccination? A vaccine is a biological preparation that introduces active acquired immunity against a specific infection or illness. The vaccination often includes an agent that mimics a disease-causing bacterium and frequently composed or weakened or destroyed variants of the microbes. Its toxins are one of its surface proteins. NHS says vaccines teach your immune system how to create antibodies that protect you from disease. It's much more safer for your immune system to learn this through vaccinations than by catching the disease and treating them. Once your immune system knows how to fight off the disease, it can often protect you for many years. The vaccine will only include a weakened or harmless version of the pathogen, implying that the individual is not at risk of acquiring the specified disease. So if the individual becomes infected again against the same pathogen, the body will have the necessary white blood cells to reproduce quickly and destroy it. This is known as immunological memory. A primary response is known as the first encountering of the pathogen. The process of antigen is slow because the B lymphocytes needs to identify it to produce an appropriate antibody. By this time, the pathogen has caused an infection to take hold, which leads to associated symptoms. A secondary response is when the same pathogen has come into contact, even if it was years later. Then the memory cells will kick into action, which leads the body to produce higher quantities of the antibodies and more quickly and for longer. Vaccines are used to start the creation of memory cells without infecting the patient. Vaccines are classified into several categories, and here are two vaccines we have: live vaccines and inactive vaccines. A live vaccination are derived from wild or disease-causing virus or bacteria. In a laboratory, these wild viruses or bacteria are unintended or weakened, generally by repeated culture. Live unattended vaccines must multiply in the vaccinated individuals in order to provoke an immunological response. Once the live vaccine is used, they are given out in much smaller doses of the virus or bacteria, which replicates in the body, producing enough virus bacteria to provoke an immunological response. Inactivated vaccines are made by growing bacteria or viruses in culture media and then inactivating them using heat or chemicals. Because inactive vaccines are not living, they cannot multiply. As a result, these vaccinations cannot induce illness through infection. Inactivated vaccines tend to require multiple doses, so this means the first dose will not produce protective immunity. A protective immunity response develops after the second or even third dose. Before the introduction of vaccinations, childhood deaths were very common, especially from diseases such as measles, polio, and whooping cough. Although these diseases still exist to present day, now we have vaccinations that provide greater protection from them. Let's move on to a major disease which led to many deaths during the 1940s to the late 1960s. The measles first developed in 1796. Measles is a highly infectious disease which can lead to serious complications such as pneumonia and encephalitis. It's an inflammation of the brain. We are now going to have a look at this chart. Measles notifications and deaths in England and Wales were 1940 to 2017. As we can see here, the death rate was high and it fluctuated between the 1940s and the late 1960s. By the late 1960s, the first vaccination for the disease was made. Vaccines also available to protect against mumps and rubella. These vaccinations are combined into the MMR vaccine by Dr. Maurice Hilleman in 1971. If we take another look at the chart, the death rates only started to decrease by the 1970s. Now to present day, there has only been one death, and this proves that the vaccination has been a success. However, newborn babies have antibodies passed on from their mother at birth, and this helps protect them for a short time against measles, mumps, and rubella. And once the baby has become 1 year old, the antibodies are almost gone, and the MMR vaccine will be effective. The second dose will be given to the baby around 3 years and 4 months old, before a child starts school. Having both these doses gives long-lasting protection against measles, mumps, and rubella. Now let's talk about herd immunity. It's a scientific term describing the point at which a population is protected from a disease, either by enough people being vaccinated or by people having developed antibodies by having the disease. Take measles, for example. The World Health Organization says herd immunity for measles is reached when 95% of the population is vaccinated. meaning the other 5% will be protected because vaccinations is hampering its spread. Some infections and illnesses can be effectively controlled through herd immunity. In a specific population, it is especially important for safeguarding those who cannot be vaccinated, such as children who are too young to be vaccinated, or even old vulnerable people. The NHS offer vaccinations to children under 1 and children ages between 1 to 15. NHS can also offer vaccinations to certain adult groups, such as disabled and compromised, against influenza and flu each year. There are several immunisation programs in this country for both children and adults to ensure that uptake is easy and comfortable as possible. This is demonstrated by the availability of the NHS immunisation program for children. Other variables can jeopardise the success of the vaccination program aimed to protect the public health. The efficacy of the vaccination program is hampered by the anti-vaxxer groups' refusal to participate in such program. Some adults, on the other hand, may find it difficult to attend a clinic to be vaccinated due to employment or other responsibilities. Now, this is the end of my presentation, and thank you for listening.